Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome, ATHLers. How are you guys doing? Hope all is well. My name is Abby, your Healthy Living and Peace. Thanks for joining me this evening for our Tuesday show. As you can see, the title is Should You Go to the Urgent Care or to the ER? Should you go to your primary care doctor or provider, urgent care, or the ER? Okay, so please share the show. Please share the show. I'm going to get everything ready here. Share the show, call your friends, get everybody watching. Okay, so my disclaimer as always, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay, so I'll be going through the topics and I will also be answering questions periodically. So if I don't get to your question in time, just, I'll get to it already. Okay, so let's just start here without any further ado. Okay, let me go in here for a second. Nice weather out there today. Okay, so we'll go back here and okay, so welcome to all of you. Those of you who are watching from other Focus on Liberia also and other forums, welcome, welcome, welcome. So should you go to the emergency room or primary care doctor or urgent care? So okay, most of the time before urgent cares and all that all came about, you guys seen it all around. Urgent care clinics came about because people were going to the emergency room and didn't need to go to the emergency room, and it will also incurring so much expenses and all that it didn't need to be there, and also the wait time where you don't have to be there because you're taking care of like more serious problems. Like sometimes you go there and your finger's hurting or you hurt your finger and somebody's having a heart attack, they're going to pay attention to the patient who's having a heart attack first. So over time, urgent care clinics came about. Some of them have like walk-in clinics as well too. So sometimes it's like, do I decide, do I go to the emergency room? How bad is my emergency? Or, is this something that can wait, that I can go see my family doctor this evening? Sometimes or today, sometimes it can happen overnight and you may have to see your family doctor the next morning, but sometimes it can't wait. But so it's like, it's not serious enough to go to the emergency room, but it's not serious enough to wait for you to see your family doctors. So sometimes when you call the office, your primary care doctor, your family doctor, your provider, when you call them, they don't have the same day appointment. And sometimes the reasons why, sometimes you call and you get the recording and it tells you that if there's any kind of emergency, hang up and go to the emergency room. But sometimes some insurance company require that you call your family doctor first. I'm going to be, interchanging family doctor and primary care provider and all that. Okay. So they tell you you have to call your doctor's office first because sometimes what you deem may not be an emergency, maybe, and sometimes you think that is an emergency, may not be. So they might say, okay, yeah, we can squeeze you in. Can you come around this time? And you may want to say, okay, no, I want you to see me this morning because it's really bad. Okay. So we have like urgent care visits also in the primary care. And we also have like same day visit and sick visits too, determining on when you tell us what it is. Sometimes the medical assistant may come and say, this patient's going through this problem and all that. Do you want to see this patient here or do you want this patient to go directly to the emergency room? And then I can decide that, or your doctor can decide that and say, yes, I want him going directly to the emergency room. Sometimes they come to the office and they're like, I've been having nausea, vomiting, and diarrhea, or I'm having the worst headache in my life, or I'm having this. I'm like, just go straight. And sometimes they do come to us and your blood pressure is fine and they may be sitting there, but the blood pressure is like sky high, something else based on the symptoms that after I examine them, I have to call 911 because I'm not saying get into the car and go to the emergency room. I'm not saying it's urgent care because whatever it is that you're experiencing, you need to go to the emergency room and we have to call in the ambulance, and ambulance can be very expensive also. So and a lot of people may not go because it's like, okay, I want to go. I want to be able to take care of my health. I want to be able to live. But at the same time, I can't afford to pay like thousands of dollars to go to the emergency room and they find nothing's wrong with me. And then I'm sitting here with all of this amount of money that I have to pay. Okay. So that's the main reason. And that's the title, the reason for the show today. Okay. So, but going back to this, the most important thing here. Okay. One of the most important thing is making sure that you are following up with your family doctor every year, like you're supposed to. Okay. Making sure you go in there for your preventative care. They're doing your screening. They're doing your baseline labs. I did talk about lab work last week, any kind of testing, any kind of health management. You may be on a medication that we need to be changed around. You may need additional medications. You may need medications to be taken away from your regimen. They also do vaccination and so much more that we do in primary care that needs to be done. Okay, so and also we have all your family history, we have your allergies, we have all your medical history and all that. So we can take care of all those things right away because all we have to do click here and there and get all that information and take care of that. So, but sometimes emergencies happen and you have to go to the emergency room or you have to go to urgent care. So you're saying, okay, Abby, so when do I have to go to the emergency room? Well, I have your answer. Okay. And this is not a complete list, by the way. So I already talked about the importance of making sure you see your primary care provider every year and also as often as you're supposed to. So when do you go to the emergency room? Okay. So let me go in here. And again, sometimes what we consider emergency, the providers, your insurance company may not consider that an emergency either because they might say, oh, that could have been taken care of in your primary care doctor's office. So why did you go to the emergency room? And you're back and forth fighting the claim and also you're between your doctor saving your own life and also the insurance company. But the most important thing is making sure you get care as soon as possible to save your life. Okay, you can always pay that money back in increments. You can't get your life back, okay, or a life-changing injury. All right. So again, so Laura, what are some of the reasons that you should go to emergency room? This is not a complete list, by the way. All right, so emergency care. Okay, so when to seek emergency care, make sure, I mean, unless if it's really serious that you don't have the time, but make sure you have information about your medication, your medications list. That's why I always tell people, make sure you put your list of medications in your phone so they can just open it up and get the information. Make sure you got the most recent medication list. Also try to have like any kind of surgeries that you've had before, make sure you have that listed there too, and the year that you had your surgery, approximate time that you had the surgery. If you were recently on any kind of antibiotic, try to remember the antibiotic that you were on. If there's like heart attack or stuff like stroke like that, no, you're not going to remember that. And you may have a family member who lives with you. Hopefully they can have that information when you do go. Okay. So when do I go to the emergency room? All right. And then basically find a hospital emergency room because you can go to any time of the day. They can, unlike urgent care or walk-in clinics, they equip with the most, recent technologies and all that, your CAT scan, your MRI. They have everything there. You don't have that in the urgent care. And you also have access to the operating room. You have all these other you have all the surgeons there, orthopedic surgeons, neurosurgeons, everybody, OBGYN, everybody's there. So if you really need those things, that's the reason why you need to go there, because sometimes you may go to urgent care and the urgent care doctor or provider may do their examination and then they will have to send you to the emergency room and you'll be getting extra cost again. All right. So here are some of the reasons that you may have to go to the emergency room, Okay. Anything that involve in the brain. Okay. You have any kind of weakness, like sudden weakness, numbness on your face, one side of your body, abrupt vision loss, changing your speech, slurring your speech, abrupt confusion or confusion that started like in the past couple of hours, like you were fine and all of a sudden you're confused and your words start slurring your words, you're not saying anything you're supposed to be saying. You do want to go to emergency room for that. Okay. Dizziness, confusion, trouble speaking, like I said, severe headache, the worst headache you've ever had in your life. Or if you usually, some people have migraine headaches or other things, but you said, no, this other headache's a little different. Usually I have a little bit of headache here, or I have a headache over there one way, but this one just feels like this, the worst headache I've ever had in my life. You want to make sure you get to emergency room. 911, by the way. Okay. You don't want to be driving because if anything happens while you go in, because remember, when you're driving to the emergency room, you have to stop at the red light. You have to stop at the stop sign. You have to do all that. And minutes equals tissue. Okay. So make sure it's like, okay, the little time that you have left to get to the hospital. And we have a window where they can treat those things. And if you don't get there in time, you're talking about irreversible brain damage or something else that can completely change your life. Okay, so anything that affects your breathing, okay, seizures, so you want to go to emergency room. So if you pass out, of course, 911, go to emergency room. That thing what we used to watch, those African movies where the person passed out, are you giving them water? No, call 911. Especially if you're in a place where you can call 911, call and go to emergency room. I said short, anything with breathing. So studying shortness of breath, like you're sitting there. Usually, like if say you went exercising or you went walking or you were doing something very, strenuous and all, shortness of breath, that's normal. But if you find yourself like really short of breath and all that, and you can't, and then you don't seem to be calming down, and your body, you find yourself like really, hyperventilating. Of course, sometimes it's best get a paper bag, put it there, but at the same time, you're calling 911 because you want to make sure you're not breathing and all that CO2. Okay, any kind of choking, when you start choking, everybody knows rescue breathing. Please try to learn that. It's not the Heimlich maneuver anymore. They changed the name to rescue breathing. If it's good to learn first aid and also all of that, that you can help your family member, but at the same time, you're going to be calling 911 first, okay? Especially if they're choking and you can get the stuff out of their throat, that's fine. But if they're choking and they pass out, 911. 911, especially if it's a child, to 911. Okay. Allergic reaction. All right. Especially with like severe rash all over your body and like severe intense rash. And also for allergic reaction to, if you eat something, let's say if you're allergic to shrimp or peanut butter and you're sitting there and you're coughing, like coughing uncontrollably, and start saying, oh my God, my tongue is swollen up, my lips are swollen, and I feel like I can't breathe. That's what anaphylactic attack, 911. Okay. Bee stings. Some people are allergic to that. Make sure you have your EpiPen with you. You know how to use it. Your family member knows how to use it too, but you want to also get to the emergency room. A heart attack. Okay. Some people are like, oh, I feel like I'm having some, indigestion, and it's here and it's like over here and it's coming this way. But sometimes it's just like right at one spot. Okay. Get there. Already, chest pain, that would be the chest pain and all that, because you won't know what you're having, chest pain or heart attack. You could also be having some kind of embolism, pulmonary embolism, which is like the blood clot came loose and is traveling to your lungs or could go to your brain. And also make sure you go shortness of breath. Already. And for women, especially, listen carefully. Most, you see heart attack and people like crutching their left side of their chest there, saying, oh my God. For women, it's not the same. We don't have the same typical symptoms. So make sure when you start having some nausea and you just don't feel like yourself and like, I feel like something there, but go to the emergency room, okay? Because again, like women don't have the typical symptoms like men. All right. So what are some of the symptoms that women need to take a look? Unexplained shortness of breath lasting more than 5 to 10 minutes. Okay. Sudden severe nausea, vomiting, or indigestion. Sudden severe nausea, vomiting, and indigestion. It doesn't mean you have to have all of that. You can have some of it. You don't have to have all of it and say, well, I have this and I don't have that. Okay. Sudden sweating for no reason. Like you just, you're sitting somewhere and you're like, your body you just find yourself over sweating and all, you want to call. Sudden extreme fatigue or weakness. Fatigue meaning like tiredness and all that too. And weakness, call. Loss of consciousness again when you faint. Okay. Of course, you want to call whether you're a man or a woman. And unexplained panicking, like you're like, like that feeling like, oh my God, I feel like I'm going to die. Now, some people might say, okay, well, I have anxiety. You don't want to take that chance, okay? Because it just comes on you. You have anxiety. Usually you have anxiety over time and all that, but something just comes on you. Just feel like, right now, the way I'm feeling, I feel like I'm going to die. That's what I'm feeling right now, okay? Call right away and go to the emergency room. Alrighty. And anything severe bleeding, any kind of vaginal bleeding, severe vaginal bleeding, especially if you're pregnant. Especially if you're pregnant. When you're pregnant, you're not supposed to be having any vaginal bleeding. So you want to call right away. Any facial laceration, meaning if you cut your face open, broken bones where you can see the bones sticking out, broken bones, what do you see? Because sometimes you hurt your foot and you see it getting swollen and all. Usually there's something broken there. Fever, if you're having fever that comes with a rash, also get there right away. Blunt trauma, anything you hit your head against the wall, something heavy hits your head. Like when I'm watching America's Funniest Videos, it's funny, but I'm sitting there like, oh my God, you're gonna have a head injury for that. Oh my God. So anything that hits your head, sometimes you don't want let's say you walk right into the door and you're like, oh my God, I have like this really bad headache. Oh, I fell and I hit my head. Get there. Okay. Whether you passed out or not, if you hit your head, go to the emergency room. And gunshot wounds, of course. So it's something that car accidents, uncontrolled bleeding. If you having any kind of uncontrolled bleeding, of course, you want to make sure you add pressure, get a cloth and all that to any kind of gauze or a heavy cloth, and just apply pressure, really heavy pressure until you can get help. And when in doubt, like burns, also car accidents, like I said, when in doubt, if you say, you know what, I'm not sure whether I'm doing this or not, just go. Okay. Again, just go. Don't wait around for that. Okay. Just go. All right. And then, like I said, it may cost you some money to go, but at least you have your life. And I always say your life and livelihood, because you can be, be alive and all that, but you're sitting there, people taking care of you, and you can't do anything for yourself. And I remember one time I had a teacher way back. She goes, there are some things that are worse than death. Okay. I'm not advocating for anything there, but it's like you living in this world where it's like you're literally people doing everything for you. And if that can be prevented, go ahead. All right. So yes, you may say, okay, I got $5,000 that in medical bills that I can't pay. They can make payment arrangements, but you'll be alive and you'll be able to live and be with your family. Okay. So, in the emergency room, like again, like I said, the emergency room doctor or provider will be the one to ultimately determine whether you are having anything that is considered an emergency. So, in case if your insurance company, because they agreed to that, but insurance company might say, you know what, again, yeah, we understand that. So they might fight the claim, but you'll be alive, right, and healthy. Okay, so now let's see the reason why you should go to urgent care centers. Okay, so let me just go in here. I'm just gonna check and see. Sorry. Jerome Gaiman, great show as usual. Thank you, Jerome. Thank you. Please invite others to watch. Okay. So urgent care. So why you say, okay, well, everything else, I used to go to the emergency room for it. And sometimes I sit there, and sometimes I know people complain that, yes, I go to the emergency room, I have to sit there for sometimes. And I know some patients that sit there for like 15, 16 hours. Always when you go to the emergency room, when you go there first, the triage center, the nurses that are going to be right at the door. When you go in and do your vital signs, make sure you're explaining your symptoms very carefully. Don't just say, well, yeah, okay, I'm okay. And some people are like, oh, I don't want to make you work too hard, or I don't want to make you feel bad. I'm complaining too much. Don't downplay your symptoms, okay? Don't overplay it, but don't downplay your symptoms, especially after you've spoken to your doctor's office and say go to the emergency room. Don't downplay your symptoms. Make sure you tell them exactly what's going on, because you could be sitting there right now and the problem what you're experiencing could not be as bad at the time you went to the emergency room. But there has been some people who went to the emergency room and have died waiting in the emergency room, or had worsening condition when they went into the emergency room. So make sure when you get there, you explain exactly what's going on. And sometimes if you can get somebody to come with you, it's also best too. Okay, so when do you go to urgent care? Let's go in here and see. So urgent care, people think, means that it's a place where serious medical condition can be treated in similar, if not identical, to the emergency room, but it's different. It's different. And plus, also urgent care, what they can do is also different in other states too. So, of course, that's not going to be your concern when you do go to the urgent care. You just want to get the help that you need. Okay. So urgent care or walk-in clinics can help fill the vital gap where when you become sick or injured, but your regular doctor is not available and you can't wait for an appointment. Okay. So again, like I said, you're not sick enough to go. Your symptoms are not serious enough for you to go to the emergency room, according to the ones that I listed before. But remember, that's not a comprehensive list. And at the same time, but you can't wait to see your doctors that same day, especially if you call and they say go to the emergency room right away, or I can't wait. If it's overnight and it's not that serious, to go to the emergency room, of course you want to go to urgent care. So what are some of the reasons you need to go to urgent care? Any kind of allergies, again, like I said, you ate something and it's just like, I got a little bit of rash here and itchy stuff and all that too. If it's not worsening, of course, then you go to urgent care. They might give you some medication, some steroids, and some others, anti-itch cream and all. And if they determine that it's not serious based on your medical history, then they might take care of it right there. Insect bite or tick removal. If you got anything in your skin, you want to get there so they can pick that out, because if it's something that, especially for Lyme disease, that can have severe neurological defects, later on, go there so they can take that out and put you on some antibiotics. Ear infection, you're having pain in your ear, difficulty hearing, feels like something, like water in your ear, things like that, you can go. But that is if your primary care doctor is not open, okay, because we can take care of that. Urinary tract infection. Urinary tract infection is if you're peeing and you find yourself peeing a lot more than usual. When you do go pee and all that, you have a lot of burning sensation. It's like, okay, why don't go pee? And it burns so much. Or sometimes you're peeing a lot, or you go pee and you're not peeing as much as you're supposed to. You're like, I'm peeing, but I feel like I still have to go again. And then I go, I'm not peeing that much. So for also And you can also explain that to your primary care doctor too, because especially for men, you want to make sure there's nothing going on with your prostate. For men and women, make sure it's not a sexually transmitted disease. Doesn't mean that it could be something else that may not be sexually transmitted disease, but something else that's going on down there too. So if it's in the daytime or something like that, you can go to your primary care doctor. But if you can't wait and you're having like severe difficulty Friday evening, for example, you're not going to wait till Monday morning, and they may not have room for you to come on Monday morning. So yes, you can go to urgent care for that. Any kind of skin rash again with no fever. If you have a fever and skin rash, definitely go to the emergency room. Any kind of sprain, let's say again, like you kind of, you kind of hit your foot and it hurts a little bit, but you're able to walk, but you find yourself limping a little, you can go to the emergency room and they can check on that. Okay. If they need to send you for more, because again, do the x-ray there. And if they need to send you to the ER, they'll send you to go. Any kind of COVID testing, some places you have to call it ahead of time for appointment too, because some places still, if you have to travel, they still need that. With the COVID emergency thing out of the way now, maybe that's like going by the wayside, but you always want to check first if you're traveling. Okay. Again, like I said, fever without a rash, vomiting or persistent diarrhea. If you go there, they might say, go to the emergency room, because chances are more than likely that you may need some IV fluids, especially if you've been vomiting for over like 24 to 40 hours. Yeah, that one you might call, and then it might say, yeah, just go directly. Okay. Because if you go to urgent care, they're going to examine you and all that. So you're getting paid for examining you. I know some people say, oh yeah, I went to the doctor's office and he just basically just checked my stomach, listened to my heart, and then that I'm got all this heavy bill. That's still examination. You're still paying for that care. Okay. It's not something where we just say, okay, yeah, it's free. No, you're still paying for that care because that our expert skills that we're using on you. So it's important. So vomiting, persistent diarrhea, especially if you can take any medication for diarrhea and vomiting, like anything over the counter, and it's continued for about over 24 hours, and it's like watery coming out, and there's any kind of blood, I would suggest you go to the emergency room for that too. Okay. Wheezing and shortness of breath. If you have asthma, if you have allergies, and you do your rescue inhaler, and especially if find yourself using it much more than every 4 to 6 hours as prescribed, and you're not getting any kind of relief, you can go to urgent care for that too. Because especially if you don't find yourself more short of breath. Okay. You find yourself down there wheezing a lot and all that. I took my rescue inhaler, I took my maintenance inhaler, but nothing's working there. So I just want to check to make sure, because they can do some places can do chest x-ray just to make sure everything is fine, have pneumonia and all of that. So, and they may have to change your medications around too, because sometimes when you have asthma, and the asthma comes in stages and all that. So maybe you have gone to the next stage and you need more help. And also during this time of the year, if you have allergies and asthma, it's more exacerbated and you need extra help. All right. Dehydration. Sometimes it's like when you feel your skin and it's so dry, and you can literally feel your skin there. And sometimes you feel like I feel so thirsty and I don't know what's going on and I'm tired and all. So yeah, you can go there. They can do some blood work and see what your numbers are, your kidney numbers and other numbers, your salt, your potassium, all those things, all those different, like I said, your electrolytes and all that of the chemicals in your body. They help protect your heart and your kidneys. So if you're dehydrated, that can also have an effect on all those major organs. So they may say, okay, let's do this, or they may try to give you some IV fluids, and depending on the state where and how much that urgent care can take care of you, or they might say go to the emergency room. Okay. But most of the time you don't feel like you're dehydrated. You just feel like, I just feel so thirsty and I need to get, I don't feel myself. Okay. And sometimes, again, if you can come to your primary care doctor office, come to them. All right. Flu-like symptoms. You can be like, it's like, okay, I don't feel like I'm really sick, but I just need, somebody to take a listen to my lungs and look up my nose and everything, my sinuses, in my ears, making sure nothing else is going on there. You can go to urgent care if you can't go to your doctor's office. Again, most doctor's office also have a lot of walk-in visits too, because we have scheduled visits, but then we also leave time for people who can and sometimes people just walk in. It's like, okay, I'm here and we have to squeeze you in. Okay. So don't think that, oh my God, I can't go to my doctor's office and I'm going through this and all. It will be best to always call first, but then you can always go there. Okay. And small cuts, little cuts here and there. They may have to put, like, if you fell and just kind of cut your face a little bit, not major cuts, or something in your arm, and it may need a couple of stitches and all that. Go there, you get your stitches done. And my new doctor I just got in there, they also have urgent care right next to them too. They're all part of it. So they have the primary care and the urgent care, so they're open 24/7. So you're like, there's no reason why you should have to go to another urgent care. Yes, you should go to the emergency room for serious emergencies, but you can just come to us and we'll just take care of it, and we have your medical records and everything, so we'll be better able to take care of you if you need to come to us. So most of that is going on. Some doctors have urgent care, sometimes that basically right next door to their practice, or in the same stuff that also. Okay, so making sure talk to your doctor and see what should happen if you have an emergency. Okay. So and remember now people say, oh, urgent care. Remember urgent cares, they have doctors there, they have PAs or nurse practitioners, and depending on the state, like I said, the kind of services that they provide, these various services that they can provide. So, don't something minor that can wait, that you can go to your doctor's office, or something that the doctor's office cannot take care of. Yes, you can go, get yourself checked and all that. Okay. So, and also for cost and coverage, let me go in there. Again, coming back, the reality is you live in this world where you can just sit there. So I'm just going to go to the doctor's office and it doesn't matter and all that. Everybody wonders, especially if you're on a fixed income and like elderly people, or even if you make anybody who makes a lot of money, whether you make a lot of money, or, middle income or whatever, you don't want to, just spend your money if you don't have to. Now, there's some people out there who got enough money that don't mind spending it away, to get the best of care. But not all of us can afford that. So if you don't have to, spend that money can be better spent somewhere else, right? So you want to make sure that you, like, again, have that conversation with your doctor's office and all that too, and say if there's some things should go wrong, these are the things what should I watch out for, because depending on the kind of medical history that you have, there are certain things what the doctors say, if this happens, go directly to the emergency room. You're not just, you have something else that's going on with your body. So if you have any kind of problems, go directly to the emergency room, because it could be an exacerbation, meaning the worsening of the disease that you have. Go directly to the emergency room. Don't wait, just go. Okay, because like I said, you may need some IV medications and you may need to stay overnight. Go. And the insurance company, if you need to stay overnight to a couple of days, the insurance company usually won't fight it. You have to pay a copay, but it won't fight to say, oh, you know what, that wasn't really emergency. Okay, so that also can come into play too. All right. So again, like I said, some places have their urgent care, built-in urgent care with them too now, so you can do that. And also some hospitals too, when you do go to the hospitals, they have the emergency room and also have urgent care at the hospital too. So the triage nurse, the one that's right at the door when you get there to do your blood pressure and get your medical history and everything and get your symptoms and all that you're having, they can say, okay, you're not serious enough to go to the emergency room part of the hospital, let's send you to the urgent care part of the hospital. So they have people there who can, the staff there that can take care of that, and still you paying less money. So all of that is important. Okay. So you don't want to be thinking about the money during that time, but at the same time, we're living in real life, and money, people say money can make you happy, but it sure can pay the bill and kind of help you out. Okay. So give me some of that not happiness. So, but anyway, so and also some urgent care too. You want to check with your insurance company to make sure that they're in network, because there's certain urgent care. Now, of course, if it's serious, you want to go. You're not going to be thinking that, but some places your insurance company will tell you, okay, that urgent care is not in our network, so you may have to go to one that's in our network. And they're all over, especially if you live in metropolitan areas. Not like if you live in rural areas where maybe there's like one hospital, one clinic for everybody. That's different. But if you live somewhere there's an urgent care, I think within maybe, if you point 5 different directions, there's one in 15 minutes everywhere now. Okay, so call first. You can, and go there and say, okay, have that information with the insurance company and say which one covers me if I have to go to the emergency room, which one covers me if I have to go to urgent care. Okay, so have those conversations before things happen. I know when you go to the doctor's office, you have other things, and you can always just call. You don't necessarily have to go in. You can call and just get that information. If they don't have it, you can call the insurance company and check with that. Okay, so you don't want to end up spending money unnecessarily. And trust me, being in this business and all that too, and also just being, a patient myself, or a family member of a patient, when you see some of the hospital bills and you see some of these bills, and you be like, wow, people do GoFundMe's to pay for other things and major catastrophic injuries and all that too. But all those little bills can kind of add up after a while. So it's important that if you don't have to spend this money, you don't spend it. But at the same time, the most important thing, you want to make sure that you're getting the care that you need when you need it. Okay. The money you can pay later on. All right. So basically, okay, I was, make sure you, like I said, and then also now they have some insurance company to call them freestanding emergency rooms, um, where it's like it's not attached to any hospitals and it's actually staffed by doctors, people doing like private emergency rooms. So they have everything there. And if they absolutely have to send you to a regular emergency room to be admitted into the hospital, they'll do that too. So that's not in every state here. It's called they're in like 35 states right now. So check with your emergency search with your doctor's office. Okay, that's why I said the freestanding emergency room. But right now it's between your primary care provider, the urgent care, and also the emergency room. Okay. So basically, I hope let me see here. Let me go in here. So, always the emergency room is always like the best choice, because you can go there any time of the day because most urgent care centers are not open after maybe 10 o'clock at night. Some of them are not open over the weekend. Some of them are open on one day of the weekend. So it's either Saturday or Sunday. So then again, even if it's something minor, but that minor thing cannot wait till Monday till you go see your family doctor. And some people don't have family doctors, which is very important that you do get a family doctor. If you have health insurance, get a family, your doctor provider will be listed on your card, or you can call them and say, who do you want to go to? If it's in the network and all, and try to establish care with your primary care doctor, because that's always your best bet. We have all your medical information, we have your family information, we have all of that. So if it's something that's minor, we can tell you if it's minor, come in and we can take care of it. There's so much more we can do in primary care. And like I said, up until our scope of practice, and then we may have to send you out. But why go to the emergency room or why go to urgent care if it's something that can wait for the following day and we can squeeze you in and you can come in there? Okay, I've already listed all the things that you should go to the primary care doctor for, the emergency room for. You can go back and watch the video, and also for urgent care. It's not a comprehensive list, but at the same time, like I said, there's so many things. It's important that you establish care with your primary care doctor so we can manage your care. So we'll know that if you're calling us, all we have to do, click something and say, yeah, go directly. Now, there's also sometimes you send people to the emergency room and all the tests come back negative, and they get so mad that, oh my God, I went to the emergency room and everything is negative. And I went to go see my primary care provider and Abby sent me there. I've also sent people to the emergency room and it came back and said, thank you so very much. You saved my life. Okay. So it was always like, do I want to sit there? Maybe I'm sending somebody I'm thinking they're having a heart attack. I do the EKG. I say, it doesn't look, I don't like the way it looks. Go to the emergency room. There be nothing wrong. It could be something else that they will find out why you're there. So don't just say, oh, I don't want to go because I don't think there's anything wrong. She's just overreacting again. Do we sometimes overreact? Yeah, but your life is our license. We can always work on our license. It's your life. So I'm not taking that chance. Okay. I'm not taking that chance. Go to the emergency room. If I say go to the emergency room, I examine you and I think that you need to go. All right. I've sent people who are, blood pressure sky high. They were fine, but you're not stroking out. When I send you home and you go home and go to sleep and you have a stroke, or you go to sleep and have a heart attack, or for something else. All right. So it's very important. All right. And like, again, ER can be expensive, and most of the time the bill is like really expensive too, but it's your life. All right. So most important thing, just want to add there, it's important that you learn basic CPR. Okay. Learn basic. I know people say, okay, you can do it on you can watch YouTube, but not necessarily, because if you're watching YouTube and yes, you can learn the basics, but you have to know how to do the compression and all, because if you're not compressing hard enough, the heart needs to be perfusing, mean getting the blood into the body, into the brain and all that. So if you're not doing it the right way, you could cause some severe problems. And if you're doing it too deep, you could also, cause severe problems too, depending on how small the person is. And plus, if the person's pregnant, yeah, you want to send them right away. Also, I did a show on how to do first aid, what you should have you should have a first aid kit and what you should have in there, and know when to use it and know when to call 911. Call 911 is always the best bet. Okay. And remember, if you go to the emergency room or you go to urgent care, wherever you come from there, let me just go in there for a second. Wherever you do, make sure that you are following up with your primary care doctor. So whether you go to emergency room, you go to urgent care, you go to minute clinic, they will tell you that we've done everything that we could. Doesn't mean we found everything, but we want you to follow up with your family doctor, because again, we have to look at your medication. Your medications, they are changed. You may need referrals to go see other specialists. You may need follow-up labs, because not everything can be done in the emergency room. And even if you're admitted into the hospital, you still need to follow up with your family doctor, preferably within 1 to 2 weeks. Okay. If they tell you sooner than that, yes, then it's really important that you come and see us, because sometimes people will, they'll go and we're renewing your medications, but the hospital have already changed your medications. So it's important that you do follow up. Urgent care especially will tell you follow up with your family doctor, okay? Because they only cater to why you were there. They might see other things when they did the testing and say this is something that doesn't have to be addressed here, but we need you to go see your family doctor for that. Okay. So, and all, like, again, always make sure you have your most current medication list with you, most current, your medical history, your surgical history, your allergies, if any, especially if you're allergies to antibiotics or any kind of medication. Most of the medications that we use often too, we want to put you on it, and the next thing you say, oh my God, no, I already had that before. If they tell you had any reaction to any kind of medication before, make sure you talk to your doctor and say, do I need to put this on my allergy list? Okay, because I had this before and this caused me that problem. So so when I go anywhere, I know. And we have your record so they can know your family doctor, know your family doctor's name, know your pharmacy's name and all that too, and number. Okay, if you don't know it, we can just look up in there, but at least have some ideas. Okay, so and it's always good to have one pharmacy. If you're doing a mail-in pharmacy, some people have two. They have mail-in pharmacies and they have another pharmacy that they can get. They need to get like an antibiotic right away, because the mail-in pharmacy can send things like 3 months at a time. And also some deliver to. A lot of pharmacies deliver to, okay, for an extra amount of money. So a little bit here and there. So if you can't afford to go to the pharmacy or you don't have the time, they also deliver. The most important thing is taking your medications, making sure you have all your medications and taking them the way they're prescribed. Okay. So basically, I went over everything, the reasons why you should go, the reasons, the symptoms you may be having that you need to go to the emergency room and also go to urgent care or go to your primary care doctor. We love to see you guys. Okay. Now, when you're saying the huffing and puffing, I have literally gone into a room before and the patient's like, I'm like, oh, 911, no, I can drive. No, you cannot drive. You need to, you say right there, I'm calling 911 and you go into the emergency room. Okay. So let me just see if there's anything that I missed here. Okay. So, Jerome, I just shared to show you, it's so very important. As they say, health is wealth. Thank you very much, Jerome Gayman. Yes, thank you for sharing. You have all of you know all these people. You're fairly well known man. So I really appreciate that. Okay. So basically, know when to go. I know it can get, expensive at times, but the most important thing is saving your life and saving your livelihood. Okay. So make sure you go and stay healthy, making sure you're eating healthy, you're exercising at least 30 minutes a day, 3 to 5 days a week, as much as tolerated, taking your medications and doing everything to stay healthy, and try not to stress out too much. Okay, because there's a lot of things out there that's, to make us sad. Thoughts and prayers go out to this little kid, Ralph Yarrow, who just got shot the other day too. So I mean, you think about things that happen in the world. Sometimes I just I don't watch the news. I still watch the news to stay informed, but sometimes it does get a little overwhelming. So just, love your family, hug them, give them a big hug anytime, every time, because it's just, you just never know. Okay. And don't hold anything too much into your heart if somebody pisses you off, get mad, and then just eventually let it go. Love the people who love you. Okay. And I think I got everything. Jerome said, "Our urgent care is qualified as the hospital emergency room." Yes, the staff. Yes, I mean, yes, of course, the emergency room doctors and all that too have extra training. But yes, there are. And again, like I said before, you have doctors there. You have NPs, you have PAs and all, and then we have some diagnostic tools. But again, depending on the emergency itself. Yes, it's not saying that, oh yeah, they're not qualified, but that's outside of the scope of practice. And sometimes if you need to get to the hospital in time, again, let's say if you're having a stroke, you have to be in a hospital there like within, hopefully within 3 hours, and they have to send you the CAT scan, and they have to send you, if you have to go to emergency room to the cardiac catheterization lab, or you have to go to the operating room. Those are the things that they're not over at urgent care. So it's important that it's not so much, okay, who's more qualified, but they're more qualified over at the hospital because they deal with that every day, and they have all the diagnostic tools, and they have all the other specialists there right there to take care of you if anything should go wrong. You don't have the neurosurgeons, orthopedic surgeons, and OBGYNs and all that at the urgent care centers. So that's the reason I gave the reasons why you should go to urgent care centers and why you should go to the emergency room. So it's like, this is where you're supposed to go. If the algorithm, if this, go to emergency room, if that, go to urgent care. But sometimes, if in doubt, if you don't get anything from what I said today, if in doubt, when in doubt, make sure you are going directly to the emergency room, okay? Because you can't go wrong with the emergency room. I know sometimes it can be a little overwhelming sitting there for a while, but you can't go wrong in the emergency room. So I thank you all for watching. Okay. For all of you who are watching now, I say thank you. For all of you who will be watching later, I say thank you. And you guys know I'm trying to get to 2,000 at least by July. So please invite your friends, share the show, share the show, share the show, in case, the other friends might want to join too and help for information. All right. So take care, exercise, make sure you get enough sleep. That's something I need to do myself. Get enough sleep. Okay. Don't stress out too much. Love the people who love you. Okay. And we'll go on from there. So I'll see you guys on next Tuesday. And for those of you who are watching from other forums, you do know that I put in please join, like, and follow, because I put a lot of healthy videos during the week, Abby's Daily Dose, and then I come on live on Tuesday at 7 p.m. Eastern. Okay. So thank you all for your love and support. I truly appreciate it. Okay. I don't take that for granted at all. All right. So take care of each other. And I will see you guys next Tuesday at 7 p.m. And watch out for Abby's Daily Dose. All right now. Good night.